Hi, this is Dr. Kenyon Godwin of Active Family Water Center bringing you a Health Tip Tuesday. And today's topic is a very, very important topic and one that should have been done a long time ago. And this is going to help not just patients and people who are seeking care, but also many, many providers of all different specialties. And that is insurance. How does health insurance work? It's a big misunderstanding. You sign up for benefits at your job or business, and then you just assume because all this money comes out of your check every month or your spouse's check that you have all this great insurance to use however and whenever you like. And that's not the case. So after so many questions we get in our office about insurance and people taking it personal, like it's my fault that their benefits are the way they are, I decided to do this video and help explain how insurance really works and walk through some of these common terms that are used on insurance so that now you can make a better informed decision about your health and your health care, but also understand who's truly responsible for your health. All right, you guys ready? So here I have a form. It's filled out kind of with some fake people's names on it. I was kind of having fun with this because I didn't want to violate HIPAA. So I'm going to walk through this. I know you can't read all of it, so I'm just going to tell you kind of the main things on here, okay? So when we call in to verify someone's insurance, we get some very basic information. And the most important part starts with, what is the patient's deductible? And I'm going to pause there because deductible in my office, as far as the chiropractor goes, is very different than your medical deductible. And so that causes a lot of confusion up front. Someone will say, well, hey, my wife had a baby, or I did this, or I had this procedure done, so I know my deductible is met. Now, if your out-of-pocket was met, then that may be the case. However, if all you've done is seen a medical provider or gone to some other specialty and you've paid some money and met your deductible there, that medical deductible is different than a chiropractic deductible in most cases. Obviously, there's no alls in this, but most of the time, your medical deductible, your chiropractic deductible, your dental deductible are three different deductibles. So I want to make sure we're clear on that. So just because you've met your deductible at your medical provider or because you met your deductible at your chiropractor does not mean you've met your deductible any other place. Okay? So that's number one. Now, most deductibles that we see today are about $3,000 on average. So that means someone coming to our office and it's at the beginning of the year, or even if it's at the end of the year, if this is your first visit in a chiropractor's office, you may have on average a $3,000 deductible. That means you have to pay out $3,000 before your insurance coverage kicks in. Here's why that may be a problem for you. Because again, you're like, well, I have insurance, I have chiropractic benefits, it says I have 30 visits. Those 30 visits that it takes for you to get to that $3,000 deductible will count. So if you come in with a $3,000 deductible today and none of your deductible has been met, that means you are responsible for the bill up until $3,000 has been met. And let's say it takes us 6 months for you to get to that. In 6 months worth of time, you may have exceeded 30 visits. So let's say that, let's be optimistic, let's say you've only used 28 visits. So you've used 28 visits in 6 months and you've met your deductible. Well, you now have 2 visits left of insurance coverage. Because now that your deductible is met, you've used 28 visits. Even though they weren't paying for those 28 visits, you were, those 28 visits still count. And that's what messes a lot of people up. Because they think, well, I hit my deductible or I met my deductible, I have 30 visits, why aren't they being used, or how come that does not apply to me or work? And that's why. Insurance is a very tricky thing. It's not always in your best interest the way that it's written or the way that it goes out. But I want to make sure that we're clear on how this works. So $3,000 deductible is the average. If 0 is met, that means no benefits, no coverage has been applied yet towards that deductible. And however many visits you have is how many visits you have for the whole plan. And that's typically for a calendar year. Unless you're a school teacher or something like that, then their year is different. It's usually from August to August, okay? So $3,000 deductible. Now you may have a family deductible. The family deductible is $5,000 or $7,000. That means that usually the family member, there's a primary on the account, but then the other family members, their insurance benefits don't kick in until the family deductible has been met. And so that's a higher amount. And then the other thing we have is the co-payment and co-insurance. And someone will say, well, I know I have deductible, but I have a 50% copay. Well, again, that copay doesn't kick in until your deductible is met. So before your deductible is met, doesn't matter what your copay is. You're paying the full price until that happens. Now, down here, we also ask about health savings account or flex spending account. Those things are great. They're almost like magical, right? Because with the health savings account, especially, you get the opportunity to put money into this from your paycheck every week or bi-weekly or every month. And then that's money that you can use for healthcare, however you choose, right? And that's pretty cool because now you don't have to worry about as much as the red tape and regulation or trying to tell you what they think is covered or what you should be using it on. So whether you want to use it on massage or chiropractic or braces or whatever the case may be, it's your healthcare money to use it on. So we ask about that because our office does very well with people with health savings accounts and flex spending accounts. And then we look at the calendar year. We talked about that already. Some people have a pre-authorization they need to get x-rays. Some don't, but some definitely have pre-authorizations for MRIs and advanced imaging. And if you need that, then we have to go through some other things just waiting for that to get approved. And then there's some insurance carriers, and I'm not going to say any names, that they actually recommend or require a pre-authorization just for your regular care. And so they want this whole summary sent in, this medical summary sent in on what we find on you. And then they'll review it. Now, here's the problem. Most of the time, it's not like a doctor or a nurse or anyone reviewing this. It's like someone who's 22 years old that has this spreadsheet. They look at the codes we put on and they say, okay, this person's having headaches, migraines. Okay, we'll give them 8 visits. And then that's when chaos happens. Because now you're coming to us saying, hey, I have 30 visits. I had already met most of my deductible. And now you're telling me they're only going to cover 8 visits. And then I have to pay this huge amount out of pocket to get the rest of the care that I need. Well, that is kind of like the perfect storm. And here's what happens. Let me explain this to you. Insurance is not designed to heal you or to get you the proper care that you need. That's a misunderstanding. Okay? Your health is your responsibility. You have to make a decision at that point as far as what's covered for those headaches and what's not covered during that time. So if they decide they're only going to cover 8 visits, and if a provider, let's say myself, is in network with whoever your carrier is, that means for me to be in network, I'm in contract with, meaning I have to abide by their rules and how they want me to play the game. So if they say 8 visits, I have to do 8 visits. The other thing that means for me to be in agreement or in contract with them is the perk of me being in agreement or in contract means that I offer them my services at a discounted rate, at a certain rate. And for anyone that comes to me that is outside of those rates, or anyone in their network that is outside of those rates due to coverage issues or whatever the case may be, the charges now have to be, increased 2 to 3 times more, because otherwise there's no benefit of me being in agreement or in network with the insurance company if everyone gets the same benefits and discounts. So now after those 8 visits for your headaches, instead of your copay of 60%, which may have left you with a $30 visit, now you may be getting charged $120 per visit. And then you're upset thinking that I'm getting over on you or another doctor's getting over on you based off of these fees and how your insurance works, when it really has nothing to do with us. It's the contract and the language that's in it. So I wanted to make sure I cleared it up for you. So why is this conversation important when it comes to our health insurance and our health? It's really simple. I want you to think of your health insurance like your car insurance. Your car insurance covers hail, theft, car accidents, vandalism, things like that, anything that's big. However, what it takes for your car to run properly, the maintenance on it, the rotating of the car, the tires, the oil change, your periodic maintenance, putting gas in your car, the things that it takes for your car to run and operate to the best of its life, that is your responsibility. You do that. They don't cover that. It'd be great if they did, but they don't. Same as it is with your health. For you to eat healthy, whether it be at a certain organic store, for you to have a gym membership, for you to get a massage, for you to do the things that are essential for your spine, for your health, for your body, it is your responsibility. Your insurance is not designed for that. It's not designed to cover that. And so once we understand that concept, we'll stop making decisions about our health based on a company's recommendations or what they cover. Because then you're going to be more of a slave to what your insurance says you should get or what they should cover, based off of what you actually need. And so imagine if right now we started treating our cars the way we do our health insurance. Well, if my car insurance doesn't cover me getting this oil change every 3 to 4 months, I'm just not going to get it done. Because it makes no sense that I pay all this money a month for car insurance and it doesn't cover my maintenance. I'm just not going to get it done. And then turn around and complain about your check engine light about 3 months later, right? So I'm doing this to empower you and help you understand. When you look at people who are pretty successful, especially entrepreneurs or people that operate at a high level, there's a few things you notice about them. Besides being very educated, usually they are in really good health. They understand and they value their health. They also value their time. And so where your value is what you'll take care of. And they don't wait for health insurance companies to tell them what they can or can't do. If they have a baby and their baby has a lip tie or a tongue tie, that's usually not covered by health insurance to have that lasered. But to a mother who's trying to breastfeed, they know the importance of having that lasered so that that kid can properly latch on and feed properly. Doesn't matter whether insurance covers it or not, they're going to get it done because there's a value there. And we had to do that ourselves with our little girl. So we have to be able to be responsible and be comfortable with being responsible for our health, because though it may cost you $2,000 or $3,000 for some health care in a year for chiropractic services or something else, compare that to later on down the line, how much neglect costs you. How much now when you went somewhere that you could go to for 12 visits a year and your insurance maybe covered it, but all it did was mask the symptoms. You paid extra money or a small copay just to get periodic adjustments to mask it, but not actually correct the cause. So that leads to some injections. Well, those injections are about $2,000, $3,000 a piece. That's what they get billed for. I have a patient that got billed $10,000 per injection. So after the injection wears off, the injection has now weakened the bone or weakened the structure. The pain has come back. And now you're either looking at more series of injections or possibly a surgery. But don't worry, because those surgeries range from $10,000 to $100,000, so your deductible will definitely be met for that. Sure will. And now you don't have to worry about your deductible. You've met your deductible and you're out of pocket. But where is your health and where is your potential? Where is your longevity? How do you feel about that? So ask yourself today as you're watching this video, am I responsible for my health, or is my health insurance company responsible for my health? And if you don't like the way your health insurance is set up, then at the end of the year, make some changes. Put more money towards your health savings account or your flex spending. I'm not a health insurance agent, so I can't tell you how that works for you, but I know what we did in our house. We take control of our health. We have health insurance, but it does not dictate the care we get, where we go, and how we go about it. I hope this was a very informative video for you. You're seeing a lot of dentists go out of network with insurance companies right now, as well as some other MDs. Because this insurance game is getting crazy, and unfortunately it's a business, so it's not for our best interest. But I want to enlighten you and give you some foresight, something to think about for the future, to take care of yourself. Invest in yourself. You'll always get that money back, and it'll save you later. Dr. Kenyon Godwin, this is Health Tip Tuesday. I know it was a longer video, but guys, I really need to get that information to you so you can make some informed decisions. God bless.